Okay, so you've come to us wanting to figure out like how to help someone you care about, and they're dealing with some pretty serious mental health stuff.
Yeah.
And specifically, we're diving into psychotic depression.
Right. Or, it's sometimes called major depressive disorder with psychotic features. And it is important to be clear about what that is, because it's not just, being sad. It's not just a bad day. This is, we're talking the real core of major depression, right? Like the just deep sadness and the loss of pleasure and, just hopelessness that's really, really hard to shake. But then there's this other element on top of that. There's the psychosis.
Right.
And so that adds this whole other layer of challenge where, someone might have delusions, which is like they're convinced of things that aren't true, that really don't line up with reality.
Yeah.
And then, on top of that, they might experience hallucinations, like they see things or hear things that aren't actually there.
And all of that is, we're really getting into some serious territory here.
Absolutely.
So, what we really want to do in this deep dive is kind of sort through all this information. You've given us a lot of great material to work with, and really figure out, like, okay, what are the most important things for someone to know? What do they need to understand about psychotic depression so that they can really, be there for their loved one?
I think a really important starting point is just recognizing it for what it is, right? Like that sometimes these things can be mistaken for, they're just, sad because they went through a loss, or they're just having a hard time.
Right.
And the material you gave does a great job of highlighting this. There's an example of Sarah where, she was convinced that like she was causing like huge global disasters, and she was hearing all these really critical voices. And at first, people just thought, oh, she's just grieving. She had this big loss in her life. But it turned out to be something much more than that.
Right. It was actually a sign of something, much more serious.
Yeah.
And that's the danger there, right? It's like if you just assume it's a normal reaction to something, you might miss the fact that it's, actually a symptom of psychotic depression. And that can delay getting the right help.
Right, exactly.
So I guess the question then is, like, how do we get better at recognizing those signs? Like, how do we know it's not just, a rough patch?
Well, luckily the material you've given actually breaks it down pretty nicely into like these different categories.
Yeah.
So we're talking about, how someone's feeling emotionally, what kind of changes you might see in their behavior, and then there are these very specific psychotic features that can really, sort of set it apart.
Okay.
So emotionally, someone with psychotic depression might be dealing with a lot of guilt, right? Like just crippling guilt. Or they might feel completely worthless, just have this incredibly low sense of self-worth. And then, paranoia can be a really big one, where they feel like they're constantly being watched, or that someone's out to get them.
So that's on the emotional side, but then you were saying there are also these behavioral changes, right?
Yeah, definitely. One of the really common things you might see is someone just kind of withdrawing from everyone. They stop hanging out with friends, they stop going to events, they just kind of isolate themselves. And then, they might start neglecting basic self-care. They might stop showering as often, stop, taking care of their appearance. And sometimes, you might even see some agitation, like they're really restless, they can't sit still. It's just this kind of like nervous energy that seems to come out of nowhere.
Right. So that's kind of like two pieces of the puzzle, but then there's this third one, right? The psychosis.
Yeah, the psychosis. And that's where you start to see things like the delusions, and these delusions are like deeply held beliefs, right? Even if they don't make any sense, they're just completely convinced of them. So, I'm being watched, so that's a really classic one. Or maybe they believe that they have, some kind of special power, or they're famous or something.
Right.
And then there are the hallucinations, and that's where the senses come in, right? So they might see things that aren't there, they might smell things that aren't there, but hearing voices, that tends to be one of the most common and distressing ones. And often those voices are, saying really negative things, really critical things, really putting them down.
Right. And it's interesting because, one of the examples in the material, this guy, Mark, it really kind of brought this to life, because it wasn't just that he was feeling down, it was that, he stopped taking care of himself. Like, he was convinced that his food was poisoned.
Right.
And then, his wife would see him just like staring at walls and whispering to no one, and those are the kind of things that, it's like, okay, this is
Yeah, those little details I think are so important because they really paint a picture. You know, they help people see, okay, this is what it might actually look like if someone is struggling with this.
Exactly. So I guess the next question is like, okay, if we do see those signs, what do we do?
Well, the material is very clear about this. You know, don't wait. Don't try to figure it out on your own.
Yeah.
Get professional help involved.
Right.
Seeing a psychiatrist is absolutely crucial because they're the experts. They can assess the situation, they can make the diagnosis, and then they can recommend the appropriate treatment. And with psychotic depression, it often involves a combination of approaches.
Right.
It's not just therapy, it's not just medication, it's often both of those things working together.
Okay.
And that's so important to understand.
And there's also the question of like, when does it become an emergency?
Right.
Right. Because I think a lot of people might be hesitant to call for help or go to the ER if they're not sure.
Yeah.
So what does the material say about that?
It says, if someone is talking about hurting themselves, if they're talking about suicide, if they're engaging in self-harm, or if they're behaving in a way that's dangerous to themselves or others, that is a situation where you need to get help immediately.
Right.
That's when you need to go to the ER. That's when you need to call emergency services,
right.
Because that's a situation where you can't wait.
Yeah. And I think it's also really encouraging. There's a story in the material about Emma where she was really struggling, but her sister was the one who kind of stepped up and said, "Look, you need help. We're going to go see a psychiatrist."
Yeah.
And that was what really got her on the road to recovery. So sometimes even if someone is resistant, even if they don't think they need help, that intervention from a loved one can be so crucial.
It really can. Just having that support, someone to go with them, someone to advocate for them, that can make a huge difference.
Absolutely. So let's say someone does get that professional help. What does the material say about what that treatment usually looks like?
Well, a lot of times, it will start with antidepressants, and these are medications that they basically work to help regulate mood, and some of the most commonly prescribed ones are in these classes called SSRIs and SNRIs.
Right.
And those basically affect certain chemicals in the brain, like serotonin and norepinephrine, that are involved in mood.
Okay. So that's for the depression part, right?
Right, but then, because we're talking about psychotic depression, there's also the psychosis that needs to be addressed.
Right, yeah.
And that's where antipsychotics come in.
Okay.
And so these are medications that, they can help to kind of quiet those unusual thoughts, those delusions, and the hallucinations. And one example that the material mentions is risperidone.
Okay, so those are the two main types of medications, right? Antidepressants and antipsychotics.
Yeah, and it's important to understand that often it's the combination of those two that's really the most effective approach for managing psychotic depression. Because you're really tackling both sides of the problem, right? You're addressing the mood disorder and you're addressing the psychosis at the same time.
Right. So it's not like, one or the other. It's really often a combination. And then there's also this whole thing about monitoring, right? Like, it's not just, okay, here's your medication, see you later.
Oh, absolutely. Treatment involves a lot of monitoring.
Right.
So depending on the specific medications, you might need to get regular blood tests to check on things like your liver function or to see what the levels of the medication are in your bloodstream.
Okay.
And regular check-ins with the doctor are so important. You need to see how you're doing. You need to see if the dosage needs to be adjusted, and you need to keep an eye out for any side effects, like weight changes or feeling really sedated.
Right.
Those are things that, you want to catch early on so you can address them.
And one thing that I think is so important, the material really stresses this, is that you should never, ever just stop taking these medications suddenly.
Oh, yeah, that's so important.
Right, like no matter what.
Because if you abruptly stop taking them, you're really increasing the risk of having those symptoms come back, having a relapse.
Right.
And then, on top of that, you might experience some really unpleasant withdrawal symptoms like dizziness, nausea, things like that.
Right. So any changes to the medication, whether it's starting, stopping, or changing the dose,
Yeah,
that needs to be done gradually and under the supervision of a doctor.
absolutely. It's not something you want to try to manage on your own.
Right. And beyond just the medication, the treatment just how much psychotic depression can affect a person's daily life.
Oh yeah, it's huge. You know, when someone's in the middle of an episode, it can be incredibly difficult to function at work, to maintain relationships, to just do the things that they normally enjoy. You know, it really takes over. But you know, the good news is with treatment, things can get better.
Yeah.
It takes time. You know, it's a process. But there are examples in the material, like you know David, where you know he was able to return to work part time after about 6 months of treatment, and he was still dealing with some fatigue. You know, it wasn't easy, but he was able to start getting back to his life.
Right. So it's not like, you know, an overnight fix, but it's definitely possible to make progress.
Yeah, it's about you know gradually getting back to a place where you can function and start to you know enjoy things again.
Right. And it's not just work, right? Like there are other areas of life that can be affected too.
Oh, absolutely. You know, the material talks about libido, for example. You know, both the depression itself and some of the medications can really cause a decrease in sexual desire. And then there's appetite.
Right.
You know, a lot of people with psychotic depression lose their appetite. They don't feel like eating.
Right.
And again, that can be due to the depression or the medications.
Yeah. So these are all things that, you know, it's good to be aware of because they can be really distressing.
Absolutely. You know, it's important to talk about these things openly, to be honest about how you're feeling, and to work with your healthcare team to find ways to manage those challenges.
Right. And another thing that I think is important to address is the issue of hygiene.
Yeah.
You know, we saw that with Mark where he kind of stopped taking care of himself.
Right.
And the material suggests that, you know, family members might need to step in and offer some gentle support in that area.
Yeah.
But it's a really delicate balance, right? Because you don't want to make someone feel ashamed or like they're being criticized.
Absolutely. You know, it's about approaching it with compassion, with understanding.
Yeah.
And just recognizing that, you know, it's a symptom of the illness. It's not a personal failing.
Right.
And so offering help in a way that's supportive and non-judgmental, that's really
Okay. So to kind of like get a better understanding of the course of this condition, the material outlines these different behavioral phases.
Yeah.
Can you kind of walk us through those? Like, what does that progression typically look like?
Yeah, so, you know, it starts with what they call the pre-episode phase.
Okay.
And this is where, you know, someone might start to experience some mild depression or anxiety, but it might be subtle, you know. It might be easy to miss.
Right.
But those are the early warning signs, right? Then, as things progress, you get into what they call the during psychosis phase. And that's where the more severe symptoms start to emerge.
Right.
You know, the paranoia, the social withdrawal becomes more pronounced, and you might start to see some really unusual behaviors.
Okay.
And then, hopefully, with treatment, you move into the treatment phase,
Right.
and that's where you start to see gradual improvement.
Yeah.
But the material does mention that fatigue can often be a lingering issue.
Yeah.
So, you know, even as other symptoms start to get better, the fatigue might stick around for a while.
Right.
And then finally, you get to the recovery phase. Okay?
And this is where, you know, the person's mood has generally stabilized, they're feeling better. But it's so important to remember that ongoing monitoring is key.
Right.
Because there's always a risk of relapse.
Right.
Okay.
So even when things are good, it's not like you can just forget about it.
No, you need to stay vigilant. You need to keep an eye out for any signs that things might be changing.
Okay. So the material also talks a bit about, you know, who might be more likely to experience psychotic depression. What does it say about that?
So one thing that they point out is that, you know, while major depressive disorder in general is more common in women, psychotic depression seems to affect all genders equally.
Okay, so there's no like gender bias there.
Right. And then they talk about age. You know, the typical age of onset is usually somewhere between the mid-30s and 50s.
Okay.
So it's not something that typically happens in childhood or adolescence.
Right.
It's usually something that develops later in life. Okay. And are there any specific risk factors that they mention? Like, are there things that might make someone more vulnerable to developing this condition?
Yeah. They list a few things like, you know, if someone has experienced a significant trauma in their life, that can increase their risk.
Okay.
Or, you know, if they have a family history of mental illness, that's another factor. Substance use can also play a role. And then chronic stress, you know, just being under a lot of stress for a long period of time, that can also increase someone's vulnerability.
Right. So it's not like, you know, any one of these things guarantees that someone will develop psychotic depression, but they're all things that they can kind of stack the deck against them.
Exactly. It's about recognizing that these are factors that can increase someone's risk.
Okay. And then they also mentioned that, difference in rates of major depression overall between men and women.
Yeah.
But like you were saying, that doesn't seem to apply to psychotic depression.
Right.
So what do they say about that difference?
Well, they talk about things like hormonal fluctuations, which obviously, are more relevant to women.
Right.
And then, there are societal pressures that might play a role, the different expectations that are placed on men and women.
Right.
And then, it's also possible that women are just more likely to seek help for mental health issues.
Right. So it's hard to say for sure why that difference exists.
Yeah, there are probably a lot of factors at play.
Right. But the main takeaway is that when it comes to psychotic depression, it's an equal opportunity condition.
Exactly. It can affect anyone, regardless of gender.
Okay. So for those of us who are, trying to support someone who's going through this, what does the material say about, how we can be helpful?
Well, one of the biggest things is just education, right? Like taking the time to really understand what psychotic depression is, what the symptoms are, how it's treated. Because, the more you know, the better equipped you are to provide support.
Right. And then beyond just knowledge, practical support is huge.
Yeah.
So, offering to help with things like meals, making sure that they're eating, or, offering to go to appointments with them, or even just, helping them with things like showering and getting dressed.
Right. So just kind of taking some of the burden off of them, helping them with those day-to-day tasks that might feel really overwhelming.
Exactly. And then there's the emotional support.
Yeah.
And this is all about being a good listener, being non-judgmental, validating their experiences, and just letting them know that you're there for them no matter what.
Right. And avoiding those kind of cliche things that people say, like just snap out of it.
Those are so unhelpful.
Right, like it's not that easy.
No, it's not about willpower. It's not about just trying harder. It's a serious condition that requires treatment.
Right. And the material also recommends creating a crisis plan.
Yeah.
What should that include? So, it should have all the important contact information, like emergency number, the doctor's number, therapist's number.
Right.
And then it should also list the specific warning signs that might indicate that things are getting worse.
Okay.
So, if you start to see those warning signs, you know what to do, you know who to contact.
Right. So it's like a plan of action.
Exactly. And it can also include things like, de-escalation techniques. So if someone is starting to get really agitated, what are some things that you can do to try to calm them down?
Right. And one of the things that I thought was really interesting in the material was the story about Lena's family.
Yeah.
Where, they all went to therapy together.
Right.
And I think that really highlights how important it is to not just focus on the individual who's sick, but to look at the whole family system.
Absolutely. Because mental illness affects everyone in the family.
Right.
And so having those tools for communication, for support, is so important.
Right. So as we kind of wrap up this deep dive, what would you say are the really key takeaways here about psychotic depression?
I think, the biggest thing is just understanding the seriousness of it. When you have psychosis and depression happening together, that's a serious situation.
Yeah.
That's not something to wait and see about. That's something that needs professional help.
Right.
And then, the other big takeaway is that medication management is crucial.
Yeah.
It's not something to take lightly.
Right.
You need to be consistent. You need to be monitored by a doctor. And you can't just stop taking the medication suddenly.
Right.
That can be really dangerous. And then the third big takeaway is just the importance of support,
Yeah.
Family, friends, loved ones, that can make such a huge difference.
Right.
Just having people who understand, who are there for you, who can offer practical and emotional support, that's invaluable.
Absolutely. And the material ends with this really powerful call to action. It says, be the light in their darkness.
Yeah.
So for a listener who's, maybe hearing this and thinking, okay, I see some of these signs in someone I care about. What concrete steps can I take?
Well, first of all, don't be afraid to speak up.
Yeah.
Don't wait until things get really bad.
Right.
Reach out to your about you and I'm here to support you. And then take action.
Yeah.
You know, help them find a psychiatrist, go to appointments with them. If they're in crisis, take them to the ER. Don't wait.
Right. And I think it's also important to remember that there's still so much stigma around mental illness.
Oh, yeah.
And we need to break that stigma. So talking about it openly, sharing information, that's so important.
It is. You know, there's a story in the material about Tom who, he learned about psychotic depression, he recognized the signs in his wife, he helped her get treatment, and she recovered.
Right.
So, that just shows how powerful awareness can be.
Right. And for those who want to do more, who want to support the broader mental health community, what are some things that they can do?
Well, the material mentions some organizations that are doing great work, like Mind and Rethink Mental Illness in the UK. And in the US, there's NAMI and Mental Health America.
Okay.
So, donating to those organizations, volunteering, that's a great way to get involved.
Yeah.
And then, also just advocating for better mental health care in your own community.
Right.
Contacting your elected officials, speaking out about the need for more resources, that can make a real difference.
Absolutely.
Yeah.
And finally, for anyone listening who's struggling themselves, what message does the material have for them?
I think the message is that you're not alone, you're not broken, and you deserve help. And there are resources available.
Right.
In the U.S., there's the crisis support line. You can call or text 988, or you can text HOME to 741-741.
Okay.
And then there's the SAM-HSA treatment locator, which can help you find mental health services in your area.
Right.
And then for listeners in the UK, there's the Samaritans at 116-123. Shout, you can text to 85258. Call them at 0800-585858.
Okay.
And then there are also some great mental health charities like Mind and Rethink Mental Illness, and of course the NHS has mental health support available.
Right. So there's help out there.
Yeah, there are people who want to help, who care, and who understand.
Absolutely. And I think it's so important to remember that asking for help is not a sign of weakness.
No, it's a sign of strength.
Right. It's a sign that you're taking care of yourself.
Exactly.
And the material leaves us with a really beautiful thought. It says, the smallest act of compassion can rewrite someone's story.
It's true. Just a little bit of kindness, a little bit of understanding, that can make a world of difference.
Absolutely. And with that, a final call to action for our listeners. Share this information, advocate for understanding, and act with kindness. And maybe something to think about, beyond just this episode, is how can we, as a community, create a more supportive environment for people with psychotic depression and their families?
Right.
Like, how can we move beyond just treatment and really create a culture of care?
That's a really powerful question.
Right? It's something to really consider because, we can all play a role in making a difference.
We absolutely
And that's what it's all